Great. Okay, so just by way of a little bit of background, in the absence of any vaccine, and really given the fact that we have very limited treatment options, very few therapies that are really effective, our best strategy at this point for reducing COVID cases in the population is through infection mitigation activities and precautions. And what this really means is that we need very effective and accurate health messaging. Most Americans receive messaging about any number of crises or emergencies through the US media and a lot of TV-based media. So the US media serves a really critical role in diffusing information, especially during times of crisis or emergency like the current pandemic. But the information can be defined, processed, and presented according to the distinct views and interests of different stakeholders. And that can result in some biased delivery of information and possibly even the presentation of misleading information. And we know from prior research in different epidemics that the spread of false information is associated with transmission patterns, and it's been related to the scale of prior epidemic or pandemic situations. So just to give some examples of what I mean by this media bias, this is a selection of primarily Fox News coverage, pointing out that at various points people use the word hoax on Fox News to describe something related to the COVID-19, although, yeah, you know, in a lawsuit through the courts, it wasn't kind of clear what they were referring to. It was also related to this idea of a conspiracy theory, some Obamagate conspiracy theory, rather than a real kind of true pandemic problem. And then there was some kind of misleading information that was presented, for instance, down in your bottom left corner where it says the CDC now says coronavirus does not spread easily via contaminated surfaces. So this was sort of a, you know, misinformation of scientific data that was coming out during the early stages of the pandemic, and then even questioning whether or not the death data related to COVID-19 deaths could be trusted. So it was a lot of misinformation and characterization of the pandemic in terms of things that might make people really question sources of authority and the information that was coming from those sources. So our research question at this project was to determine whether Americans' media preferences were associated with their virus mitigating health behaviors, particularly during those first couple of months of COVID-19 when we were all trying to figure out kind of what was going on and when that health messaging was so important. We had two hypotheses. The first was that people who had more trust in Fox News compared to CNN would practice fewer preventive behaviors and more risky behaviors. And because we knew that the media narratives were shifting over time, we also hypothesized that the differences in these behaviors according to that kind of media trust or media bias would also change as well. So we used data from the UAS COVID national sample, and just to give you a sense of what we did in terms of sample restrictions, we took the entirety of the baseline sample that started in the panel in March. We did exclude 1,991 people because they did not complete all 5 waves, although we checked the samples and our analytic sample wasn't significantly different based on that exclusion. We also excluded a few more people, 79 people who were missing on covariates. So this is the Adfonsis media rating scale on the left side of your screen. It ranks a bunch of print and television news sources from around the world based on a level of political leaning. So leaning to the right, you would see things like Fox News, and leaning to the left, you would see CNN. So they do designate CNN as left-leaning. They designate Fox News as hyper-partisan right. We picked these two in particular because they are on such opposite ends of this continuum, but also because they have the largest viewership in comparison with some of these other sources. So in the UAS survey, respondents were asked, how much do you trust the following sources of information about the coronavirus? And the response options ranged from trust completely to do not trust at all. We took answers to the question with respect to CNN and Fox News, and we created a 3-category media preference measure. So we classified people as trusting CNN more if their trust score for CNN was higher than their trust score for Fox. So for example, if they said they trusted CNN completely, and even if they said they trust Fox News mostly, we said that they had a bias for CNN. We also had a group of people who we would consider to have equal preference or no preference. So that could indicate that they had the same level of trust in both CNN and Fox, or that they trusted neither. And then for people who trusted CNN less than Fox News, or people who had a bias towards Fox News, were those who had a trust score in Fox that was greater than their score on CNN. To give you some sense of the distribution on this variable, about 29% of the sample trusted CNN more than Fox. About half had equal or no preference, and about 20% trusted Fox more than CNN. We also accounted for in our models whether or not people were accessing other sources of information, including professional sources like information put out by the CDC, HHS, the WHO, local public health officials, and we included information about their access to other sources. So for instance, if they were getting their information from the president or the vice president, we adjusted for that in our model. And we also adjusted for other characteristics, including things like whether they were working from home, because we thought that that would be an important dimension to consider in terms of viewership of television and also kind of overall risk in terms of whether or not they were being exposed in the community. So these are the preventive behaviors that are asked about in the UAS, and we just looked at the proportion of people who engaged in these behaviors based on that media bias variable that we created. So the light blue line on the top are people who trust CNN more. The dotted line in the middle are those kind of trust equally or not at all type people, and then the dark solid line on the bottom is the people who are biased a little more towards Fox News. And what you can see in basically all of these graphs, although a little less clearly only for washing hands, is that in terms of avoiding public places, wearing face masks, avoiding eating in restaurants, or engaging in social activities, that the people who trusted CNN more were more likely to engage in these behaviors than the people who trusted Fox News more. We also examined this in a regression model where we predicted their score, adding all of those behaviors up. We also interacted all of those scores by wave with the media preference variable that we created because we wanted to examine that change over time. And we adjusted for a lot of covariates, which are listed here on the right side. But this is just to show you that there were statistically significant differences in the preventive behavior scores between those who trusted Fox News more and those who trusted CNN more. So those differences that I just showed you in the descriptive information were borne out in a fully adjusted multivariate model as well. And actually, even people who kind of have equal trust in both of these sources, sorry, that's my timer, they were more likely to engage, well, they were less likely to engage in preventive behaviors than those who trusted CNN more. And there usually wasn't a statistically significant difference between the kind of trust equally group and the trust Fox News group. So it really does seem that CNN was doing a different job in presenting information related to COVID behaviors. We also looked at risky behaviors. These we could only look at from wave 2 on, so these start in April. Oh, sorry, the last point I want to make is that you can see that the differences between the Fox News folks and the people that trust CNN more really also increased over time as the pandemic continued, and it really matched quite well some of the shifting narratives in Fox News. Particularly, you can see here it's widest in May, which was the last wave of data that we looked at, but this was also consequently when a lot of the reopening narratives started circulating through the news media, in particular Fox News. I just want to point out we saw really similar patterns for risky behaviors, but I'm going to go straight to the multivariate results to show again that just as the people who trust Fox more had fewer, they were less likely to engage, or they had a lower score on preventive behaviors. They have a higher score on risky behaviors, and this is a statistically significant difference throughout the study period. But again, we found that the largest difference in the study period was in that last wave in May, when the media narrative shifted towards kind of a more relaxed stance to COVID, particularly on Fox News networks. So our findings do indicate that people's response to the pandemic is divided along these media bias lines in the United States. It's very clear from the data that people who trusted Fox News more than CNN were engaging in fewer preventative behaviors and more risky behaviors. And we also saw that difference between those two groups did become more pronounced as we progressed from April into June. But I do want to note that we can't establish any kind of a causal association here between people's media preference bias and their health behaviors. Also, we focus really on Fox News and CNN as kind of proxies for political bias in the media, but the UAS does ask about these other sources. But based on that kind of continuum I showed you and the fact that they have the largest viewership, this was an appropriate comparison. And then finally, it's really important to note that we don't have direct measures of the respondents' consumption of media or the content of the information that was being disseminated by the media sources that they were accessing. But other studies have done this kind of content analysis and have shown pretty convincingly, I think, that kind of consistent messaging that we're getting here, that the people who are consuming media that's biased, that has some kind of political slant, are getting less reliable and valid information about the coronavirus. So I just want to quickly acknowledge our funding sources and to point out that this paper was recently published in BMJ Global Health, and so you can go there to read it if you're interested.